Awesome day outside today. So warm. Right, so today, guys, welcome. We've got Dr. Simon Chard from the BACD. He's going to be talking a few little bits and pieces, mainly just advice for younger dentists. So that's going to be a really good one. Let's just pop in the topic and see if he's joined us. So, Dr. Simon Chard, and we are doing advice for younger dentists today. There we go. There is our topic. Guys, how are you all doing? What are you up to today? It's great weather out in the UK today, so Iman's here, awesome. So we'll have some interesting comments, of course, from you. Who else have we got? Tooth Fairy Journal.
Hello, mate.
Hi, Simon. How are you doing?
I'm very well, thanks. How are you?
Good. I'm boiling. It's so warm today. It's
beautiful, isn't it?
Nice change of pace. How are you managing down in London?
Yeah, very well, very well. I'm just on the outskirts, so it's a little greener here and a bit quieter. So been enjoying the day with the family and playing out in the garden and that sort of thing. So yeah, can't complain.
Yeah, I think we're looking at barbecues today, so should be a nice little do later.
Yeah, I've been enjoying the barbie as well.
Yeah, but awesome. Yeah, I think most people know who you are. Pretty much, I'm guessing. For the guys who are not UK based, very quickly, where did you qualify from? What jobs did you take, and what are you doing now?
Yeah, sure. So I qualified in 2012 from King's. And I, after my vocational training year, went into 3 practices. So both my parents are dentists, and which is the practice that I've recently bought from them. Yeah. So I did 1 day a week there, and then I wanted to spread my experience, not just in that one practice, but to learn from other people and different ways in which people were doing things. So I went into one mainly implant-based practice, which was Harpal Charna's clinic in Teddington. And he's a restorative consultant. So that was kind of like I always see it as like a paid DF2 position, like a paid hospital position, because Harpal had all this experience and I would go in and shadow him and learn from him, and we would treatment plan cases together and that sort of thing. And he does a lot of full arch implant restorative, a lot of full arch implant surgery, sorry. So I learned a lot about that as well, which is the main focus there. And then the other clinic was actually where I just fell into the digital dentistry world. That clinic, the owner of it also was a reseller of CEREC machines. And so that allowed me to get a very early insight into the digital workflows that you could achieve with CEREC before it became such a hot topic as it is now. This was sort of 7-8 years ago now. So I've been using CEREC ever since then. And yeah, obviously now I'm a cosmetic and implant dentist is the way I would describe myself. Most of my work is minimally invasive aesthetic dentistry, but always using the latest digital technology to either improve outcomes or improve the patient journey and comfort. So I now own a 7-surgery multidisciplinary practice with my wife, Megan. We've got about 25 staff, 9 dentists, a couple of an endo, perio, just bringing in ortho now. So yeah, that's me basically.
Yeah, whistle stop tour of your career.
Yeah, exactly.
Kind of sets the scene, like who you are. But I think that kind of means that you've got a really, really good kind of backing and grounding a lot of areas. So guys in the comments, if you're wondering about certain career paths, just standard questions, whatever it is you're thinking about doing, drop those in there and we'll try and get through them. I don't know if you joined with Ansar or with Jazzy last week, but we did 5 most used emojis. So we've got to drop those down in the comments. It's just a little bit of fun.
Five most used emojis.
Yeah, someone asked us, and I thought, you know what, this is hilarious. So
what are the 5 that I use the most?
Yeah, so like if you're an iPhone, most recent, bang them out, see what happens.
Okay. As in, like all the ones on the left-hand side. They're the most
Yeah, down
frequently
that little
used.
column.
Okay.
Yeah.
That's my 5 there.
Guys, drop yours down there as well. We've got a question. Awesome. Iman, of course, with the question. I think everybody knows Iman's going to ask a question. What is the easiest way to get involved in digital dentistry?
Well, I guess if you're an associate, the easiest way is to find a practice that's already using a digital scanner. If you're in a practice that you're happy with and you're not, and they won't buy a scanner, or they can't be persuaded into doing so, then I do know a number of associates who have bought digital scanning equipment for themselves. And I think if you can, whenever anyone asks me what scanner should I buy, my first answer to that question is, what do you want it for? So there's 3 sort of main categories. You've either got the CEREC system, which is the one that I use mainly, which allows me to manufacture restorations in-house, which has a number of benefits that we can talk about later on. And I personally love that system. It's its own ecosystem, so it's not actually closed anymore, but it's a little bit closed, like Apple. You've then got just the standalone scanners, of which there's many, and some of them are really cheap now in dental terms. So the classic ones for that is sort of the 3 shape. But there's also the Medit 500, which is a sort of a less expensive one now, and there's other even cheaper scanners coming onto the market now. And then there's the iTero, which is obviously an Invisalign scanner. And if you want to increase your Invisalign output, that's your business argument for making that purchase, because they've shown that with an iTero scanner, you will have much more patients uptaking Invisalign treatment because of the immediate visualization of their outcome that you can provide to all your patients. So that's kind of the overview, I guess. But I think everyone really eventually will go digital. It's just a question of when they make the jump, really.
I tend to agree. We had on Christina Blatcher from America. Her handle's Queen of Invisalign, and she uses it for absolutely everything with her iTero. I know they just brought out the 5D, but there's all sorts of things from occlusal analysis to impressions for all crowns and bridges, etc., as well as just your standard Invisalign. You can be doing things like checking your wear patterns and progression of wear.
Absolutely. Really, I mean, I think that the digital scan is going to become, in essence, the new charting. For me, it's now just a part of the routine examination. So I'm just going to close the door because the baby's crying and I haven't shut the door here.
No worries.
So I think it's become, for me, part of the routine examination, and I think eventually it's going, once the software, the sort of patient management software catches up, it's going to become just in essence maybe replace the way we chart teeth at the moment, which would be great, because you get so much more detail than you do than just putting it in those sort of square boxes that you get on the various softwares that we have available to us.
Yeah, I tend to agree. I mean, things like you can be looking at clinical attachment loss in recession, and that's just perfectly, taken there without having to get out your DG, whatever, whichever probe you're using to measure that with a Williams, etc., etc. It means that you just got so much more information. It's saved. You can see exactly what's there. The patient can see it, more importantly, and then you can go from there and build your treatment plans. Another question. This one's half cut off. I'll read the rest of it we've got down there. Everyone will enjoy the same success you seem to have had for the moment. That's because everyone's journey is different. The question is, any advice for those guys who maybe struggle a little more? I paraphrase the question. It's quite long.
Struggle more with their careers?
Yeah. If you fall into the wrong job, and you struggle in that kind of side of things, and then you maybe take a couple of missteps or something like that, how would you get back on track?
Well, look, I mean, I think the most important thing to say is it may look as though, okay, how do I phrase this correctly? I have enjoyed a lot of success in my career, and I'm very grateful for that, but there's been a lot of hardships along the way as well. And
of course,
for example, the job that I discussed with regards to where I got my CEREC experience, there were a lot of negatives in that practice, and I learned a lot of the ways that I didn't want to be in my own clinic moving forward. And I was a very young grad. I was a very young grad to be in a practice that was at that level of clinical dentistry, and that was a very stressful time for me. And that's often why I recommend to a lot of young grads, they may want that sort of super swanky private clinic to go straight into, but actually working in the NHS and learning your craft and working in scenarios where there isn't that added pressure of high financial burden on the case actually is sometimes a much safer and a more enjoyable environment to grow as a clinician, because no one comes into this world being an amazing dentist. You work hard, you practice, you document, you practice, you make mistakes, you fail, and then eventually you failed enough times that actually you're successful. So I'm still learning all the time, and I think the most important thing for people to remember is that all the most successful people have failed repeatedly. And I saw a quote recently, I think it was from Michael Jordan, which said something along the lines of, I've missed 30 or 300, or I can't remember what the exact number is, but I've missed like more game-winning shots than I've hit, and I've lost the game for everyone. But it's those ones that he sinks and he wins the game on the last minute and he hits the three-pointer and everyone goes wild, that everyone remembers. And it's by failing that many times that actually you become what people view to be a success. But I guess that's the best way to answer that.
Yeah, I think I would kind of agree. I mean, myself, I'm in a very nice practice at the moment, but there are things which I'm thinking, actually, I want to do X, Y, Z. And I might, look at other alternative, ways of doing things in the future if I were in that sort of situation of owning a practice. But obviously, COVID aside, it's very, very difficult at the moment.
COVID's a different kettle of fish because there's limitations put on you. But I think if you're in a job that you're not happy with, then just leave. No one's making you stay there. There's so many practices out there that you could go and work in. And if you're in a situation where you don't feel as though you're being pressured into doing things in a way that you don't want to do, or you're unhappy with the environment and you're going in every day begrudging it and hating it and really like not enjoying the thought of being there, then why put yourself through that stress? There's no amount of money that you can make that can make up for that unhappiness. And I just think people are always scared of change. That's natural for everyone. But actually taking that leap and making that move, afterwards you'll look back and you'll think, oh God, I'm so happy that I got out of that situation. And I think it's really useful. This is why the BACD has been so amazing for me, because I've had that network of mentors from a really young age in my career, and I've been able to bend people's ears and ask their advice and say, is this normal? Should this be different? Like, should I change? And there's loads of job opportunities that come through that as well. So I would advise people who, if they are struggling with their careers, find a community that you can get involved with in whatever area of dentistry is your passion, and then ask advice from other people. And if you want to DM me with questions, then I'm more than happy. I'm always happy to answer them where I can do. I don't have all the answers, but it's I think the one good thing to come out of this whole COVID thing is that there seems to be more unity in dentistry than ever before, and I think that's really important.
Yeah, I think it's been really good. We've had, I think we must be nearing number 60 in terms of the live podcast that I've done now. And there've been a big range of people from across the globe who've been, giving advice, saying, oh, this is how you want to do an endo. We've had Karina on, you might know from London. Really, really good teacher. So she's been teaching stuff. Loads of guys come on, even if it's been a bit more of a non-clinical side of dentistry. We've had a lot of support from people and, learned quite a lot. So hopefully the guys who've been tuning into all these different webinars, which have been going on for free, will, go back into practice with a few more little tricks up their sleeve.
Sure. But the thing is, mate, you're a prime example. Like, you're doing something different. You're working your butt off in creating content and doing things like that. And I think that's the key for everyone. Like, if you're unhappy in your situation, then just try and develop your own USP, your own niche, and then just work until it becomes a success. I was lucky in some ways that digital dentistry, I sort of fell into my niche.
Yeah.
But that's been great for me with regards to lecturing from a young age and that sort of thing. But the cosmetic dentistry side of thing, I just worked really hard. I went to every event. I went to so many BACD events when I was an undergrad, a new grad, felt so awkward, didn't know anyone. And a lot of the time I'd go to events and I'd be like, why am I going to this? Like, it's really awkward that I don't know anyone here. But then you go to enough of these things and eventually you do know people, and then you become part of the community, and then everything follows from there, and your network grows, and your network is your net worth, as they say.
Yeah, I think the kind of the key point there is even yourself, who's, you know, been very lucky, and myself, who I would say, you know, 2 years out of uni, I've been very lucky with the FD job I had and then the job that I've had afterwards, and they've been very good jobs for me. But even then, if I was looking for things to complain about, I could find something to complain about.
Yeah,
it's better to look on the brighter side of, actually, just for example, the nurses are really good and they're quite helpful, or our reception are really good with my book. Just, you know, find that positive point and build upon that, and then think, oh, actually, this is pretty good as well. And you tend to feel much more settled in yourself and happier once you start thinking, actually, this is pretty good. Okay, that's not so good, but maybe I can work around it. And then once you're a bit more settled and content and a bit more grateful for everything, then things seem to open up. I don't know if that's how you've seen things, but I felt that way as well.
Yeah, I mean, like, as with everything, the more you do things, the more comfortable you become in your surroundings. And so small things that are wrong may not actually have as much of an impact on you as before, because you have more self-confidence than previously. If you're really unsure about doing a procedure, and then your nurse is sort of slagging you off behind your back or in front of the patient or something like that, and you're already anxious about the procedure, then that's going to make your day a hell of a lot worse. Whereas for me now, I mean, obviously I'm the principal now, so it's slightly different, but even before then, there's nothing really a nurse can say to me that's going to stress me out, because I'm very comfortable in my surroundings. I'm comfortable with what I'm doing. But definitely when I was a younger dentist, I remember one time a nurse said to me after speaking to a patient, she said, you share too much of yourself with your patients. They don't want to hear about it. And I took that very personally, and I was absolutely livid. Now I think I would just laugh, but
yeah,
I guess that's how you develop as a person and as a clinician.
I think we answered Aman's question already. It's the network effect of BACD, which really helps you. Here is asking, as a young dentist, how did you deal with some of the failures clinically, so ledgers, and how did you improve the confidence around it? Did you think it was courses that helped you, or just having those experiences and thinking, next time I'm going to change what I do a little bit?
Yeah, I mean, I'm a big fan of failure. I think you learn the most from the times when you really mess up. And I've definitely messed things up in my time. And I really like the phrase, you either learn or you win. So you're either successful, or if you do fail, then you've learned from it. And so then you've been successful in that phrase as well. I mean, with regards to the clinical failures, how do you deal with them? Something like that. Like, let's say your RCT is short, and you can see it. You realize that you've not provided as satisfactory a solution as you wanted to. Then take the money out of it completely, and just either, if you feel competent enough to do it effectively for your patient, then redo it yourself. And if you don't, then ideally you'll have mentors around you who can assist you. Maybe you can send it to a colleague, or reimburse the patient and say, look, this is outside of my level of expertise. I'm going to send you to this person. And then ideally, if you have a good relationship with that endodontist, let's say, or even more senior clinician, they'll allow you to shadow them. And then you literally are learning, so that you learn from that difficult scenario and it doesn't happen for you again. I think the worst thing you can do is try and hide it away like you're a really bad person and that you've ledged on your RCT or it's short. And so you try and hide it and don't tell the patient, and oh God, what happens? They're going to be mad. That's, for me, is the worst thing you can do, because I don't know if you've read the book Black Box Thinking by Matthew Syed.
No, I've not. No.
It's all about failure, and he talks about the airplane industry versus the medical industry, and how in the
Yeah.
airplane industry it's not a blame game. They have the black box. Everyone learns from the failure, whatever that failure is, technical or pilot based, and that failure gets disseminated. The information gets disseminated across everyone in the whole industry. Whereas
Yeah.
in medicine and in dentistry as well, if you fail, it's assumed that it's the clinician's fault. And therefore, the natural culture within the industry is to try and hide your failures so that you don't get in trouble. So I think for us as dentists, we've got to get away from that. Failure is not anyone's fault. It's the only thing that's guaranteed is that a certain percentage of your procedures will fail. And now, if you feel that you're failing again and again in the same area, then yes, you need additional training in that so that you don't fail. But again, I come back to the point that no one was born blessed with the skill of the crown down root canal technique. And it just comes down to training, practice, and again, good mentorship.
Yeah, I think that's kind of key. If you manage to find yourself into, I don't know, for example, let's just stick on the endo route. If you're interested in endo, go in there, find a practice where someone's got an MSc and is happy to kind of jump in and say, actually the MBT is there, or this is how you get down it. You know, just drop in, almost like you were back in uni, where your clinician would come in into your little bay and say, okay, just do this next, and that can be really helpful. I know that I've been really lucky with that. My TPD is an endo guy, and so am I. So I'm actually working in his practice now, where he's an associate, and he's next door to me. He jumps in. He showed me how to use MTA, find canals, all these different little bits and pieces that had I just gone for, I don't know, a really big private job somewhere where they're just throwing cases in the door, I wouldn't have that learning opportunity. So I think that's really useful. Kind of pick your battle.
But what I'd also say is, if you are repeatedly messing up endo and you hate doing it, and you're in a position where you're not working in the NHS and you can pick and choose what you do, then at some point you can just say, I don't want to do endo anymore. Prime example of that is me. I don't do endo anymore. I've hired an endo guy to come in and do all my root canals for me. Now, I'm in a very lucky position that I can do that. But as you say, if you choose to work in a practice where they have an endodontist or a guy with an MSc in endo, then you can do that. No one's going to make you do root canal outside of any systems that do, i.e. the NHS. But if you're working privately, then you can focus in if you want to, and you can be really narrow and just do the procedures that you want to do if you're working in a multidisciplinary team.
Yeah, I think that's a really nice way to do things, because, for example, yourself, you're interested in the implants, you're interested in the restorative side. It's a lot of work to then be really good at ortho, really good at perio, really good at, you know, X, Y, Z, oral surgery, all these other things. You can just focus in, laser focus and go, I'm going to get really good at these bits. And the guy next door is going to get even better at the other bits. So you all kind
and they'll
of
see things that you won't see. I mean, I'm bringing in an author at the moment, and we are having discussions about a few cases. And she's an author who's worked a lot with restorative dentists. So she used to be Gallup Gurel's orthodontist. And they teach you things that you don't see. Even I know a lot about a lot in general dentistry, in cosmetic dentistry. I'm a complete geek, so I've seen. I feel like I've seen every case going, but even I don't have the sort of mechanical, orthodontic, physical knowledge that she has. And she's like, oh yeah, we're going to move this zenith here. We're going to bring that down slightly, and it's just to a level that I've never seen before. And it's that's the sort of dentistry that I want to be doing. And for that, I think you do need. You can be a very good generalist, but to be top drawer, I think you do need to have other people you need people in the room who are smarter than you, I guess.
Yeah, you want to be not the thickest guy, but the least intelligent guy in the room, or the least experienced. So you can pick up, especially as a young dentist. If you're 2 years out of uni and the other guys are 1 year out of uni, it's going to be a recipe to a little bit of a mess, should we say?
Yeah, no, you need. So you can't. Even with doing every course in the world, you can't beat experience, and
No.
you don't know what you don't know. And when you're young, certainly when I was young, I thought I knew everything, and I really didn't. And I'm sure there's lots of young dentists who are just like me in the same situation.
Yeah. Let's move on to a slightly different topic. I think it's still Mental Health Week or month. Is it month?
Just finished,
week?
I think.
Just finished. Right.
Yeah.
We almost managed it. But just to touch on the mental health side of things, because it can be stressful. It can be, quite a lot if you are struggling a little bit. What are the things that you do outside of work, outside of dentistry, that keep you grounded? I know you've got a young family. What are your other support structures?
Yeah, so mental health in dentistry is a topic that I'm really passionate about. It's something that I've been talking a lot about for the last couple of years, to be honest with you, but only recently it took COVID for me to put together a lecture to actually start putting it on the podium and putting more of a spotlight on it, because I think the more we talk about it, as has been shown by this question, and as is shown by every time I speak about mental health on my social media, I'll have someone DM me saying, thank you for that, or I'm really struggling with this. And sometimes it's people that you would never expect. So I think the first thing to say about mental health is, if you're struggling with your mental health, you're probably more in dentistry part of the norm than the abnormal. The way in which I deal with it, and I've done a lot of research on this for the lectures that I've been doing. I'm actually doing a lecture for Invisalign on this on Wednesday. But three main sort of key tips that you can take away that, as I say, are completely based in science. So yes, they work for me. So anecdotally, I support them, but that I've done the research to make sure that I'm only recommending things which are heavily based in science. The first thing is exercise. So it's quite specific, 45 minutes of exercise 3 times a week. Doesn't matter what it is, but that's going to give you, and this is quite a strange stat, but this is from a massive paper in the Lancet. I think it was 1.3 million people this study was on over 4 years. And they basically found that if you do 45 minutes of exercise 3 times a week, you'll have 1.5 less days per month of mental health problems, which is a really interesting way to look at it. But that's what they found in this study. So I thought that was very interesting. So I make sure that I exercise every day. At the moment, to be honest with you, I'm exercising twice a day, but that's just because I've got more time on my hands. So exercise is key for your physical and your mental health. The second thing is diet. So there's something called the gut-brain axis, or the GBA, and that's been proven to have, they call your gut your second brain. So what you're putting into your body, you're just like a computer. If you put in good information, you're going to get good information out. If you put rubbish in, you're going to get rubbish out. So there's some key food groups which you can look up online. Things like, and obviously it depends on if you're vegetarian or not, but actually a lot of vegetarian stuff is actually better for you. So things like spinach, cruciferous vegetables, broccoli, and then on the meat and fish side of things, anything that's offal, so like liver and that sort of thing, or seafood like mussels and oysters and crab and that sort of stuff. So I'm I make sure that my diet is very good, and I make sure that I'm getting a nice, diverse sort of nutrient base. So I always make sure my plate's very colourful, lots of different colours, very good quality of food, no processed food, or minimal processed foods. We all have our weaknesses sometimes. And then the final thing, which has probably been the newest addition, but actually the most powerful, is meditation. So I try to meditate every day. I'm the first to admit that I'm probably not the best at doing it every day. But meditation has been proved to work in the same way as exercise, so through the same pathways. And it's been really, really powerful for me. And again, they've proved on randomized controlled trials that meditation, and specifically mindfulness-based meditation, will aid in the treatment of mental health disease, of course, but also actually of acute inflammatory disorders and acute sort of systemic disorders as well, which I found amazing, that by meditating and by doing something within your brain, you can have an impact on how your body reacts to actually sort of systemic problems as well, which is really interesting.
Yeah, I think the exercise thing is so often under kind of emphasized. When, for example, myself, I look back, I felt at my best when I've been exercising more. You feel more virile, you feel more up and at it, ready to go and do things. Even within the lockdown, the days where I've exercised, I've been more inclined to go and cook afterwards and use more healthy ingredients, etc., etc. Days where I've not, and maybe just lazed around a little bit just because I was like, oh, it's a lockdown, I'm a bit bored now, I can't be bothered to do X, Y, Z. Then you feel less willing to go and do extra things and, you know, get on top
like
of
a self-fulfilling prophecy, isn't it? It's like a positive cycle or a vicious cycle almost.
Yeah, it's 100%. So it's kind of weird. Once you get on the bike, it'll make sense to you. But the guys who aren't on it can't kind of compute that actually doing more exercise doesn't make you more tired. It makes you more alive. It's really crazy, but it does work. And it's kind of that thing, you know, when someone has a big breakup and the guy hits the gym and he just, you know, to get all the negative energy out, it's a definite thing. Or he goes to play loads of football, or he does, you know, more exercise. Same with the girls as well. They go and, you know, detox and do all these kinds of things to make yourself feel better. It's an actual physiological thing as opposed to just a mental thing.
Yeah,
you make your body healthier and then your mind feels better as well.
yeah, absolutely. And I think that's I've always loved exercise, and that's been my sort of go-to. If I'm in a bad mood, if something that's annoyed me, I'll go for a run, I'll do some weights, and I'll feel much better afterwards. And I think the key thing for me with exercise is doing it in the morning, because then I can't find an excuse to not do it. Whereas if you try and do it after work, your patient will turn up late, you'll run late, you have to see an emergency, and then you've got an excuse not to do it. Tarek's got a question there on meditation. I'll just explain what I do. So I've got a few practices that I try and do every day. One of them is something called the 5-minute journal, which is something I picked up off Tim Ferriss. You can get it on Amazon. And in essence, it's just a little book that I write in first thing in the morning. And it's basically a gratitude practice. So Tony Robbins always talks about the fact that where there's gratitude, there can't be any fear. So if you're feeling grateful, it's very difficult to feel fearful at the same time. So that's what I try and focus on first thing. And it has it guides you as to what to write, but it has a quote. And then it says 3 things that you're grateful for, 3 things that would make today great. And then in the evening, you do the same just before bed. So it's a nice bookend to the day for me. And you write 3 things that were great today, 3 things that you could have done better, I think it is. One thing that you're proud of, or something like that.
Yeah, it's similar to what I was saying earlier about when you're in a job that you're maybe not so happy with, find a couple of bits that are, oh, actually, this is pretty good, this is pretty good, this is pretty good. Yeah. And maybe you start to feel better about the situation. You can maybe look at things without that dark cloud over your head. So I think that's really important. I know you've got to run, don't you? You've got a virtual console.
I've got 5 minutes, so I'll just finish this for Tarek, because I love this topic. Just on your point, you just said something really interesting there, which is one of my favorite things with meditation that I picked up from Headspace, which I'll come on to in a sec. But you said there's a dark cloud there. And one of the key things I always try and think about when I'm in a really bad mood about something is whenever there's a dark cloud, whenever you look up and there's dark clouds in the sky, whenever you've been up in a plane and you go through those dark clouds, what's above the clouds, there's always blue sky up there, isn't there? And I think that's such a great analogy for meditation, because if you can, what you do by meditating is you just focus on the present, and in doing so, I feel like you penetrate through that storm, and then you actually can visualize the sky above you. So I found Headspace to be really, really useful. I've also found breathing exercises like stuff from Wim Hof to be quite powerful as well. So those are my 3 things that I do. I'll do some sort of guided meditation. I'll do some breathing exercises, which can just be breathing in and out for the same length of time for a few minutes. So as in your inhale and your exhale, you keep them at the same length. And again, that's just something to create focus in the mind, I think. Yeah. And then, the 5-minute journal, and those 3 things have been really, really useful. They're really easy. It probably takes me about half an hour a day to do all 3 of those things.
Yeah, it's just things that it takes a couple of minutes. It's almost just to slow you down and go, I'm going to stop for a few minutes. and give yourself that time just to settle. I think that's kind of, from hearing you speak, that's what it sounds like to me. And there are loads of ways of doing it. So guys, hopefully you can try that and see if it works. Let Simon know how you felt about it.
Yeah, please do. I think we all,
yeah.
as dentists, we all need to meditate. It's great. There's been lots of questions from a few patients saying if they can't get to their dental practice, what do we suggest they do? Well, I wish we were able to see. Unfortunately, at the moment, we're not allowed to. We're hoping that's going to change very soon. But at the moment, if you're in pain and you're struggling, then I would call your practice and see if they can help you over the phone. And if they're not able to do that, then they should be able to refer you to one of the urgent dental centres, of which there are 500 across the country. But yeah, it's a very difficult time in that regard.
Yeah, we're on the phones on 7 days a week, even through the weekend. So
yeah,
there are practices going above and beyond what they would normally be doing. So guys, you can get in touch. And then if it's out of hours at a funny time of day, there's always 111 as well. So definitely, if you need to get in touch with people, there are people available for the dental pain side of things.
yeah.
I'm wary about the time we've got because
That's been great, mate. Good chat.
Yeah, I think this has been great. Maybe we'll pick up it again some point. I think the meditation and stress and mental health side of things are definitely something we could talk a lot about. I think it's an area we're both kind of passionate about, and got some interesting takes for sure. And we can definitely get some interesting bits and pieces out there for the guys.
Yeah, the more we talk about it, the more normal it becomes. I've struggled with anxiety. I have done in the past. I still do today. It's part of life. It's just how we manage that. That's the key thing, I think, and just looking out for each other, just making sure that we don't ever let it get so bad that we become suicidal, because that's a real problem in our profession.
Yeah, for sure. I think there's definitely things that we can do for each other that are going to stop anyone getting to that point, and hopefully we'll all get on board and kind of help each other out there. I think that's definitely something that we should be doing more of. But thank you, Sam, for your time. I know you've got a rush. It's been really, really enjoyable having you on. Hopefully the guys have taken some bits and pieces away from you. Make sure you're already following Simon if you're not. And if you're not following me, please do, and turn on live notifications. We're going live basically every day until lockdown will end. So we'll have lots and lots of guys on with different topics within dentistry, slightly left field dentistry as well. So hopefully you'll enjoy those while we do them.
Cool. Thanks, man. Appreciate it.
Awesome, guys. Thank you for joining us.
Stay safe. Bye.